affects up to 600,000, that's right, 600,000 New Zealanders, including 1/3 of women after childbirth. Of course, I'm talking about incontinence. Dr. Cathy Stephenson is here to discuss this very sensitive topic. Cathy, welcome to the show.
Thanks, Sarah.
And of course, reading my research that you had given me, I didn't realise that there's not just urinary incontinence, there's also, I'll say it, fecal incontinence.
Fecal incontinence, you can say it, it's fine.
I've never heard of that before.
Yeah, well, 340,000 New Zealanders will have fecal incontinence, and that's either leaking or urgency associated with passing a bowel motion. So it's really common, but we do not discuss it, unfortunately.
Well, let's start by discussing that side, because I know we're going to focus mainly on the urinary because it's more common, but how would you ever end up with this fecal incontinence?
Probably the most common reason is damage to the pelvic floor during childbirth. So if you get a bad tear during childbirth that can involve around the bottom, then that will very often lead to fecal incontinence. And it's a problem that can happen with ageing too. But yeah, it's really embarrassing for lots of people, and you know, sadly people don't go and get help. I think less than 1 in 3 people actually ever ask for help for that problem.
If you have it, are there treatments you can get to fix it?
Yeah, absolutely, definitely.
Now, we're going to talk about those treatments at a later stage, but today we're going to talk about the causes of these two incontinences. So let's go back to the urinary incontinence, really common for women after childbirth. And why is that?
Well, there's a thing called the pelvic floor, which is a sort of a sling or group of muscles at the outlet of the pelvis. And its role is to stop leakage of urine, leakage of feces, and also to support the organs in the pelvis. So that's not only the bladder and the rectum, but also the vagina. So it prevents incontinence, but it also helps with sexual function as well. Now, when those muscles are damaged, which is often either due to childbirth or, you know, they just get a little bit slacker and weaker as we age, then you can obviously see that its role to support those organs and to stop leakage is damaged as well. So that's when the problems usually start.
So what are some of the signs, I mean, other than obvious incontinence? There are things like I've heard of people when they go running and trampolining. Like, I wouldn't want to jump on a trampoline, you know, those sort of things after you've had a baby.
Yeah, well, there's 2 kinds of incontinence of urine. One is stress incontinence, and that's the one that you're talking about, and that's usually the one people think of. Much more common in young women, and that's leakage of urine with either jumping, running, sneezing, coughing, laughing, anything that puts strain on that pelvic floor area, and then there's often some leakage with that as well. The other kind is something called urge incontinence, and that's an overwhelming desire to run to the bathroom really quickly and pass urine, and if you can't get to the bathroom, that's when the leakage will happen. That's more common in older people, and it's very common to get what we call a mixed picture, so a little bit of stress incontinence and a little bit of urge incontinence, and they're both treatable, and going to see your doctor or another health professional like a midwife or a physio will help them determine which type of incontinence you've got and what the most appropriate treatment will be for it.
Is the urge incontinence, is that psychological or is that physical?
It's a little bit of both. I mean, it's not really psychological, but it's often caused by something called an irritable bladder, where you get into a sort of habit of going to the loo more often and your brain starts to think that it needs to go more often. So you can actually train it out of that habit like you can with anything, actually.
Let's talk about the pelvic floor and this whole pelvic floor exercise. And we've talked about, you know, I've been doing the show 4.5 years. We've talked about it a lot. And every time we do, I'm like, got to do it. And then you don't do it.
Yeah.
I mean, how frustrating is it for you as a doctor when you tell your patients to do it and they just don't?
Well, I think part of the thing is we actually, as doctors, we don't ask people about this enough and we don't talk about it enough. And part of that is that we probably don't know how to do them very well ourselves either. There are midwives out there who are very much involved in, you know, the care of women immediately after birth, and they will have good knowledge about this as well. And there's also specialist physios dealing with pelvic floor exercises and incontinence too. So there's lots of health professionals that you can approach if you've got an issue. But yeah, I think primarily we should be asking our patients as well. You know, we should be bringing this up when we do smears and see women after babies and saying, is this a problem? Because I can help you. You know, I can help you sort this out.
How often should you be doing, once you've learned how to do them properly from one of these health professionals, how many times a day is it required for a woman?
Well, ideally, I mean, they say every hour, but I actually think that's probably completely impossible for most of us. But I think if you can incorporate it into your day, you know, 4 or 5 times where you do a little run of them and you try and do a combination of short exercises, so fast ones and slow ones, and you do a combination of both of those. And if you can do that regularly each day, you know, I think up to 75% of women will get huge improvement of their symptoms with those exercises. And that figure's even higher if you involve someone like a specialist physio.
That's incredible. Those are such good statistics. gymnastics. Very quickly, the other thing to bear in mind is when we're hitting menopause, you say these symptoms can be exacerbated. Why is that?
Absolutely. Well, I mean, one of the risk factors, obviously the risk factors being female and having children, although it does happen in men as well. But another risk factor is just getting older, because after menopause there's no estrogen, all our muscles get slacker, the muscles in the face, the muscles in our body, and also those pelvic floor muscles get slacker too. So if you've had a problem before, had a problem after childbirth, it's going to get a lot worse as we get older, sadly.
But if we do the pelvic floors, we can
absolutely
mitigate that in some way.
It's completely preventable and treatable.
Thank you so much, Cathy. Always great to have you on the show.
Pleasure. Thanks, Sarah.